First off, we have the mid-sagittal slice of our C-spine with the foramen magnum through which the spinal cord exits the skull. The ring of C1 surrounds C2's odontid process, and the vertebral bodies C3 through C7 exist distally with their spinous processes posteriorly. Outer cortical bone defects, in which are used to diagnose potential fractures, appear much brighter than the inner spongy bone, while an abnormally large or narrow disc space likely represents some pathology present. There are also key lines of alignment, namely the anterior vertebral line, posterior vertebral line, spinal lamina line, and interspinous line that are checked to rule out any slipped vertebrae. Anteriorly, soft tissues such as the nasopharynx, oropharynx, larynx, and esophagus can be appreciated to assess any swelling of tissue or the presence of a foreign body. Moving slightly laterally, we come across the hyoid bone as well as the atlanto-occipital joint, which is observed as a tightly articulating joint unless a fracture or dislocation has occurred. Further laterally again, the facet joints between adjacent cervical vertebrae are a crucial point of reference, confirming or ruling out dislocation or fracture on both the right and left sides. Moving on to the axial plane, now starting at the C4, which is a typical cervical vertebra, we can see the vertebral body, the transverse processes with their transverse foramen which contain vertebral arteries and veins. Moving superiorly through the slides at the level of C3, we start to see the hyoid bone, which sits anterior to the laryngopharynx. Another soft tissue structure you can appreciate at this level is the epiglottis. As we reach the C2 vertebra, or also known as the axis, we can start to see the mandible appear as well. Interestingly, the C2 is the strongest vertebra in the C-spine. At the level of the atlas or C1, we can see the dens of the C2. The atlas is another atypical vertebra with no body or spinous process like C2. It is comprised of a posterior arch and an anterior arch which articulates with the base of the skull. This point of articulation is the occipital condyle, which is demonstrated in here, as well as the foramen magnum. In the coronal plane of the C-spine, we get a great demonstration of the articulation between the occipital condyle and the lateral masses of the C1 vertebra. This view also provides a clear demonstration of the dens as well as the entire C2 vertebral body. This region is prone to fractures, so it makes this coronal view important for assessing this. Also, in the coronal plane we can see the uncinate processes of the vertebral bodies, which is another unique feature of the cervical vertebrae. The coronal plane also provides a great view for assessing the facet joints,